medical coding. So, we are going to introduce you to this new profession, and I'm sure once you go through this demo, I'm sure most of you are going to select this profession as your, future career. So, hi everyone. I think uh, you have showed interest in this profession. Maybe you know a little bit of what is medical coding. So, all of you are from life sciences background. Yes. Anyone who want to respond?
No,
Everybody.
ma'am.
Okay. Okay. So everybody's already. I can see our old students also. Okay. Acha. So I think those who have started training, they know what is medical coding, but this is for the benefit of students who are joined for a demo session to know about what is medical coding. So today we are going to tell you about medical coding. Are there new students also, Ajay, joining us?
See, guys, this demo is only for students who are joining for new. Okay, not for the existing students. So kindly exit the meeting if anybody has already joined the the course.
So I can see Bushra, Anifa, Mamta, all are old students.
Yes, yes, yes.
So I think you already had the demo session. We can have classes from Monday, but this is basically for the benefit of students who want to know what is medical coding. So my students are already into, they already know terminology and everything. So that's great. We'll continue with the classes, but this is definitely for new students. Okay, Ajay. Anyway, let me start. I think we can give a couple of minutes more for new students to join in, right?
No, ma'am, that's fine. You can start actually.
Okay. Okay. So, first of all, guys, welcome to this demo session from CodEvo. And about CodEvo, first I want to tell you that this is a training and placement uh, institution, which is almost 3 to 4 years of experience in skill set training and placements. And our academy is certified by the government as a startup company with international standards. Okay, and we have online, offline, hybrid uh, modules of teaching, and we are into RCMS services. So we'll be coming to know about RCMS services, but we want to tell you that our staff is having 15 plus years of experience in the medical coding field, and also total RCMS services are covered by us. We do we do training in AR follow up, billing, coding as well. Okay, so let's go into what is the future of this particular field, medical coding. And medical coding is a emerging field, that is having no restriction at all. This is one field in entire economic activities like business and other industries. This particular field is the only field that does not have any recession. In fact, this industry had a upswing during this, unprecedented pandemic, which was COVID. For literally 2 years, everybody suffered with this. All the countries, they had to go through this pandemic, which destroyed lot of countries' economy, and they had to go through lot of life loss also because of this pandemic. So, having said this, during pandemic there were so many hospitalizations, so many people who took treatment. Some of them really could recover, some of them could not, unfortunately, but bills have been generated. So this RCMS cycle is a process where the medical bills are coded and they are sent to the insurance, and the insurance pays this bill. So revenue cycle management services, they are the ones who are having almost about 30,000 RCMS jobs waiting right now. Okay, just a moment, guys. 1 minute. Can I just take 1 minute? I'm getting a call. Sorry for the interruption, but as we can see, there are about 30,000 job openings in RCMS services. So we'll be knowing what is RCMS services in a bit, but before that, I want to tell you who are eligible for this training and placements. First of all, for medical coding, we are looking at people from life sciences background, especially anybody from graduation or post graduation are eligible from all the life sciences background, plus B pharmacy, M pharmacy, PharmD, BHMS, and BSc nursing also, or any specialty like physiotherapy and other associated medical technology can join, like radiologist, somebody who's a technician, lab technician also is eligible. Okay. And about the academy, as I told you, it is certified by the government as a startup company. And faculty, as we saw, we have very experienced staff members who are working as RCMS employees, plus they are into training and placements from last 6 to 7 years. Okay, and as we saw, the classrooms are both online and offline. For people who want online, we will be conducting online classes. For people who want offline, they can come to the academy and they can have classes there. And we are also having hybrid module where uh, you can come for a day or two in the week whenever it is convenient for you. And we we are giving 100% assistance in placements after the training is over. We make sure that uh, we get you jobs, like there will be post training grooming for interviews, how to handle your interviews, how to clear your interviews. We get the feedback from the HR and see if you need to be groomed on any aspect, like for example, personal introduction or technical rounds. We do give the assistance till we see that you get a placement in one company or the other. And according to the preference, like for example, people who are in Hyderabad, we'll see that you get placed here. And people who want outstation, like in some other states, like maybe Chennai, Bangalore, Bombay, we do that as well. Okay. And this is our certificate that you can see. And now, our engagement model, it is 5 days a week, and 1 hour class will be there. And if you want to have some practice session, you can very well stay back for half an hour or 1 hour and go ahead with your training session as well. Now, bi-weeklies, we have sessions with the trainer and the students, where we can discuss about any queries or questions that the students have. And we generally, what we do is we invite people who are already working in the process so that they can share their experiences with the new trainees. And we have an exclusive training session where our attendance is monitored, assessments, their performance is monitored, and as I told you, we groom them for interviews as well. Okay, as we have the connects with different HRs from different companies, we do invite the HRs to have a interaction session with the students so that they will have tips on how to apply, what is the prerequisites that they should develop before appearing for interviews. All that will be taken care by us. Okay. Now, coming to the academy members, the hierarchy is Miss Manisha Rao. She is the founder and CEO, and she's a very young female and entrepreneur, and we are very happy to work with her because she's a very enterprising young woman, Manisha Rao. And Mr. Shrikant Joshi, who's a founder and director, he's a senior faculty. And I'm Miss Beena Madhusudan. I'm the senior faculty. We'll come to my introduction in a bit. But Mr. Ajay and Mr. Gausuddin, they are the first point of contact in the academy. Like, you can contact them on any issues, like if you want to register, or if you want to have any demo session, they are the best people. And they will guide you in every aspect, whichever query you want to be addressed, they are the best persons to do that. So whenever you want to register in our academy, Ajay and Mr. Gauss, they are both the best people you can depend on. And this is a glimpse of our office. As you can see, this is the classroom, which is an AC classroom with a projector and state of art classroom, in fact, because we curtail, or we keep our batch strengths anything between 15 to 20, so that we can give individual attention, and the classrooms are very comfortable. So this is our office. And now to the core, which is what is medical coding. So when guys, we have seen that coding is very common in every aspect of life. So most of us know that we have barcodes, we have color codes. Barcodes usually you see in any packages that are being delivered, and color codes we see when you are going to shopping. You see green and red are the color codes that you see. Green indicates vegetarian, red indicates non-veg. So like that, coding also something to do with this diagnosis and procedures are converted into codes. And coding is nothing but making something very concise and very, very easy to understand. So that is what is medical coding, but let us go into it in a more detailed way. So we know we have coding in IT field. So the IT person, he will do back end coding, and we can see the product on the screen whenever we open some apps and all. That is because of the coding that is being done, or programming that is being done by our IT personnel. So this is what is coding. Now we'll look into what is medical coding. So the term medical coding is, in fact, you are turning medical terms and medical procedures into codes. So what a medical coder has to do, you will be understanding that in a bit. What a medical coder has to do, that is what is very important. Medical coder, he reviews a medical record and he will read the medical record, try to understand what was the diagnosis or what was the problem for which the patient had to get medical treatment. So, a medical coder has to read that, understand the disease or conditions that need medical treatment. Then, during the treatment, definitely the doctor will do some procedures. It could be anything from, you know, normal band-aid changing to stitching up of a wound or surgeries which are required for, you know, the patient to get the problem resolved. Like for example, you have fractures, so the fractures will be treated by doing some procedure like putting a cast or putting a splint. So not only that, some patients will have chronic conditions like diabetes, hypertension, arthritis. So that conditions are regularly taken care by the doctor. So that is called as evaluation of problems and their management. So a medical coder will have to read, understand the diseases for which the treatment is being done and what are the procedures that are being done for the treatment of the patient. So this is what we have to read and understand. This is the job of a medical coder. So they basically are trained in the overview of US healthcare. We'll be working for US healthcare because right now US healthcare is covered by insurance. At least 60 to 70% of US population is using health insurances for covering their medical experience expenses. So first of all, we'll be teaching you about what is American healthcare. Then we'll be teaching you about what is medical terminology. Terminology is study of diagnosis. Why we have to study this diagnosis? Because Western medicine is made up of Latin and Greek words mostly. This, so we teach you how to understand them very easily, how to learn about these diagnoses, how to read and understand this different difficult diagnosis. Then we teach you about human anatomy and physiology. Anatomy, of course, you know, is the structure. Physiology is the functioning. And then each system will have some kind of related disorders. So we teach you about that. That is called as pathology. Then, importantly, after you are taught what is anatomy, physiology, and pathophysiology, you as a coder have to turn these diagnosis and procedures into codes. So, ICD-10-CM, which is International Classification of Diseases, 10th revision, is a software or a book which is used only for coding the disorders, diseases, and conditions. So we code the diagnosis with ICD-10-CM. So you will be taught in detail about how to use this ICD-10-CM to do the coding. Then we come to the next book, which is called as CPT or Current Procedural Terminology. In this, procedures are coded. So, as I told you, procedures can be as simple as band-aid changing to as complex as organ transplant. So, you'll be using this current procedural terminology to do the coding of that. And then we have HCPCS, which stands for Healthcare Common Procedural Coding System. And in this, what you do is we code for everything that is given for the patient during the treatment. For example, patient may be having a fracture and is recovering from the fracture. So when he wants to move about, he might either use a crutch or a walker. Okay, so all these durable medical equipment like synthetic eye or synthetic skin or artificial eye or artificial limb will be coded by using this healthcare common procedural coding system. Okay. And when we come to the most important thing, we were talking about RCMS or Revenue Cycle Management Services. So today we'll have a look at what is Revenue Cycle Management. And then HIPAA is very, very important. It stands for Health Insurance Portability and Accountability Act. Why it is important is because in America there are two federal insurances called as Medicare and Medicaid. So people who are below the poverty line and people who are 65 and above, people who are not, who are having disabilities, who are not able to take care of their conditions, the government gives them the insurance. So every penny or dollar that is utilized has to be accounted for. So HIPAA is the rule and regulations through which all this monitoring takes place. So we'll be teaching about that, and we'll also teach you about the three P's of healthcare, that is the physician, who is a doctor, the patient, and the payer, who are insurances. Okay, so first of all, we have to see what a coder does on day-to-day basis. First thing what we should understand is American healthcare as such, we said, is known as revenue cycle management services. So when a patient goes and meets a doctor and the doctor is providing some services, the patient has to pay the doctor, right? So there is a revenue generated. The bill which the patient has to pay the physician is the bill or the revenue that has to be paid. And who's paying it? The insurance is paying it. So that is a roundabout way of paying money to the doctor. Here, what we do in India, we go to a corporate hospital. First, we pay 1,000 rupees at the counter, and they give us a file, and we wait for our turn in the line. And then our turn comes, we'll go meet the doctor, but we have already paid the money upfront. But in American healthcare, what happens? The patient's bill is generated, it is sent to the insurance. After insurance goes through the bill, it decides whether it wants to pay or not. And when it decides to pay, it goes to the physician. So, how this amount goes from the insurance to the doctor on behalf of the patient is called as revenue cycle management, and there are a lot of processes in between. One is your transcription, then second is medical coding, third is medical billing, fourth comes cash posting, and then there's a denial team which talks about, or rather researches on why some claims are denied. They try to see how they can resubmit the denied claim and how to again get back the funds. So that is called as denial team. And the last one is at the end of the revenue cycle stands account receivable, account receivables team or account receivable follow up. This particular team, what it does is it talks to the patients, it talks to the insurance companies, it talks to the physicians, and their basic work is to get all the pending payments from the insurance company or from the patient. So they try to maintain the finances of the hospital. So this is one of the processes that we are also training: billing and AR and medical coding. For AR, we can train any graduate as long as they have good communication skills. And basically, it's a night shift. But for medical coding, we are looking at people from life sciences background and any associated processes from healthcare, like some be dentistry, physiotherapy, EMTs, and all those people. Okay, so let us go and have a look at what exactly a medical coder does on day-to-day basis. So let's go there and check out what it is. Okay, so for your understanding, I have bought in a small sample health record, and this health record is created after you know the transcription. What they do is they will convert an audio file into a medical record, and this medical record contains the patient's information from the name, date of birth, address, telephone number, etc., etc., to his insurance details as well. Insurance policy name, insurance policy number, everything. And then you have another section which is called as your medical history. So, what you see, what a coder has to see is the name, and everything should match, and then they will see what exactly happened with the patient. So, that will be detailedly given in the health record. So, let us have a look at one of the sample records, which is a very simple one that I'm going to look at. So, here it is. There's a 66-year-old male, and he came to the doctor's office on so and so month, date, and year, and patient was discharged from doctor's hospital because he had pneumonia and he was treated at the doctor's hospital. Now he is discharged, but the patient is continuing to have some severe symptoms like severe orthopnea. Orthopnea means when the patient is sleeping, it will become very difficult for the patient to breathe. So that condition is called as orthopnea. He has to sit up to breathe properly. Now, paroxysmal nocturnal dyspnea, that means patient suddenly has difficulty in breathing. Dyspnea means difficulty in breathing during the night times, and it happens suddenly. Then he's having cough, and then his sputum is greenish in color. So greenish color indicates bacterial infection. His exercise tolerance is about 3 yards for shortness of breath. He is not even able to walk for 2 to 3 yards before he becomes very breathless. And the patient is actually having a blood thinner on regular basis called as Coumadin. Patient stopped taking Coumadin for reasons not very clear to him. He was documented to have recent atrial fibrillation. So atrial fibrillation is a heart condition. It is called as abnormal heart rhythm. In this condition, what happens? The atria of the heart, instead of contracting and relaxing, it starts to flutter. So that is called as atrial fibrillation. Patient has long-standing history, sorry, excuse me, of ischemic heart disease. Here, ischemic heart disease is nothing but heart attack. So patient suffered a heart attack some time back, and he has a heart condition which is called as end stage left ventricle systolic dysfunction, and he has an instrument that is called as in, implantable cardioverter defibrillator. Because he's having a problem called fibrillation, he is having this instrument that controls this condition. Okay, and his fasting sugar this morning was 130. So as soon as the patient tells his problem, the doctor will do what is called as a physical examination, where his BP, sugar, and everything. Just a moment, guys. I think there's a lot of disturbance because there's construction going on in front of my house. So, Madhu, so his vital signs are recorded, like BP is 120 by 60, and his respiration rate is 18 per minute, and his heartbeats are 75 to 85, and his heartbeat is irregular as the doctor has noticed, and his weight is 207 pounds. Then he checked his head. Here HENT stands for head, ears, eyes, nose, and throat. So, head is normal, eyes are also normal because the doctor looks into the eyes to see the color of the white portion of your eye. If it is very pale, it means patient may be having anemia. If it is yellowish in color, it may say that it indicates that patient may be suffering with jaundice. Oral hygiene is good. Neck is supple. Why do they check the neck? Is that thyroid gland is here, your trachea or windpipe. They check that, and on the side of the neck, you have major blood vessels, that is your carotid artery and your jugular vein. So they just check it. And lungs, they usually check by doing a procedure called auscultation. That is, they hear the sounds through stethoscope. So during this auscultation, the doctor could hear that patient is having wheezing, and there was sounds in the lung. And now cardiovascular examination, patient is having first and second sound. Usually we have this lub dub sound, which is very, very vital. It is called as sound 1 and sound 2. That indicates the opening and closing of the heart valves to pump blood out of your body. Then he has seen the abdomen is soft. And what happens during this examination is they want to see whether liver is enlarged or spleen is enlarged, and they also check the legs and arms to see whether there is any swelling, because usually patient may have swelling of the feet and hands if there is any cardiac issue as well. So here there is swelling in the legs. Now, patient when he comes, he may be already using some medications. So doctor has to consider what new medications he can give, because he has to take into consideration what are the regular medications that the patient is having on his day-to-day life. So here the listing of the medication is given. Ambien, which is a sedative that gives you sleep. Coumadin is the blood thinner because he's having cardiac conditions. He is taking the blood thinner. Then he is a diabetic patient, so he's having insulin. And because of heart condition, he's taking a tablet Lasix that helps in reducing the edema or the swelling. And you have this Flovent, which is drug that will control asthma. So the drugs also will give you what may be the possible conditions the patient is suffering. So now we come to the diagnosis and plan. Like after all this, the doctor will decide what is the diagnosis that patient is suffering from and how he should treat it. So that will be known as diagnosis and plans. So atherosclerotic coronary vascular disease with old myocardial infarction. Now we've seen myocardial infarction means it's heart attack, and atherosclerosis is when your cholesterol goes into your heart arteries, the coronary arteries, and they start to build up layers and layers of fat which obstruct the blood flow. So that condition is called
Secondly,
as
you will comfortable in English or
atherosclerotic coronary
we are
vascular
from CodEvo
disease.
Academy
Okay,
and
and
we
he is
give
having
you the medication.
moderate to severe
The
left
surface,
ventricular
but they leave tooth
systolic
marks.
dysfunction. That means there is a 30 heart failure condition in this patient. Then he's having sugar, diabetes mellitus, and that diabetes mellitus or sugar has started to affect his kidney. So diabetic nephropathy and renal failure is the condition which the patient is suffering, and he is also already having a instrument which is called as a small device which is called as in implantable cardioverter defibrillator. Then the new problem of atrial fibrillation is documented, and very importantly, if a patient is on Coumadin or any blood thinner therapies, it has to be documented. So it is documented. And what did the doctor plan? He said, let him continue with the drugs that he's using right now, and he can come back to my office in 4 weeks' time. Okay. So this these are the conditions. Now you can see this is the uh, diagnosis that is for
Certain
each
formulas
disease.
or like
So instead of writing atherosclerotic coronary vascular disease, I'm giving a small diagnosis I25.110. And then for old heart attack or myocardial infarction, I'm giving I25.2. And because the patient is having long term use of blood thinners, we are going to give that as I71.01. I48.191 is atrial fibrillation, the new condition. And the CPT code or procedure code, we will be coding it as 99215, which is office visit for evaluation of his problems. Okay. So these are very, very concise. So when we are going to bill this to insurance, if we do it in a traditional way, then you have to scan all the 20 to 30 pages of the documentation and send it to the insurance. So they might take about a 1 month or 2 to 3 months just to go through one document and decide whether they want to pay it or not. Right? So if we do it in this way, this will become a single one time document. It is one page document. So it's so easy for the insurance, and the insurance people also know all these diagnosis and CPT codes because we have softwares. As soon as you put a code, the description of the disease will be uh, displayed for the person who's reviewing the bill. So he will be able to understand, and he will be able to understand whether the treatment was correctly given or not. Okay. So after reading the bill, after seeing that these procedures were medically necessary to treat that patient, the insurance will approve the claim and they send the payment to the cash posting team. Okay, so this is all about medical coding, and this is again a question and answer session. I just want to show you some examples of how medical coding is done and how easily we can teach you all this. It may sound very difficult because there are thousands and thousands of diagnostic codes and thousands of CPT or procedure codes, but it will be taught in such a way that you just have to learn few guidelines, and you will be able to learn medical coding within 2 to 2.5 months. Okay, so I have finished your introduction to medical coding, and I would love to have any questions or queries from you. Any questions and queries, guys? Yes? Okay. Uh, I can see all of them are from old batches. Any questions and queries for me? Gauss and Ajay, can you uh, send a form where they can even type some of the queries? Okay, Gauss. So, guys, you have understood what is medical coding? Was it interesting? Yes? Okay. Let me show you how a medical bill looks like. Okay. So, let us look at the medical bill. So, how it shows up. Just a moment. Billing forms. I'll just show you the billing forms exactly. Gauss, you can send that form. There are people joining now. Okay, after the session is over. Okay. So what you could do is you could again play back this. So I just want to show these people again. Maybe we can go through this medical record once again so that students will be able to understand, or is it not necessary? I want some students to ask me any queries because I want to know how far you have understood the medical coding process. Anybody? Okay. Let me just show you the billing form. And this is the reason why medical coding is becoming very, very uh, useful because it has reduced the work of the insurance people. This is actually the CMS 15 form where your diagnosis would be entered in this column. Here you can see, and the procedures would be entered here, and the charges will be entered here. So this, because of the coding, the billing has become very concise, and it is only one page billing that goes to the insurance company. Okay. And to look at the books, let me show you the ICD 10 CM books. This is the book ICD 10 CM. This is a book which we use for coding medical conditions. Okay, and this is how it looks. You have a alphabetic index through which you will pick up the code. For example, if you look at here, esophageal polyps, they are coded with the code K22.82. So, and you might have some other codes, like for example, yes, anyone who's having any questions? Okay, I can see Sonali. She has joined right now, I guess. And who's this? Mahantesh. Have you missed the explanation? Kirtana, I think, is my old student. But as I was showing you, we have this ICD 10, which are alphanumeric codes. You can see this alphanumeric codes are given here. So we can code conditions which are adverse effect of drugs, poisoning of drugs, and also we can code situations, personal life situations as well, like this is a person with food insecurity, this is a sheltered homeless. So there are so many different codes, and according to the document you can do the coding. And then we have your CPT, which is your current procedural terminology. That means you are coding your procedures using this book. So when we look at this, let me show you some of the procedures. This is called as evaluation and management. That means in evaluation and management, the physician, what he does is he evaluates a chronic condition with the patient is suffering. Maybe diabetes, hypertension, or maybe cardiac disease, or any other condition like cancer. So every month, if the patient is going, the doctor will evaluate the problem, like maybe it is responding to treatment, the patient is recovering, or the disease is not recovering, the patient is not able to respond, and the problem is becoming worse. So they try to evaluate the problem and take a different protocol to treat the patient. This is called as evaluation and management. And then you have other sections like surgery, where you code different procedures in that. Okay, so let me show you something to do with surgery. Here, this is surgery being done on skin. So you have some codes like, simple repair of superficial wounds of scalp, neck, and axilla. And then you have some other procedures which are in musculoskeletal system. So all these codes will be given. You have to learn only the terminology. For example, here you have index of procedures which are done on shoulders, and these procedure codes are usually 5-digit codes that explains the procedure. Okay, so when we look at an example here, we can see. One minute, guys. I think looks like I'm getting a lot of calls today. Okay. Okay. So we can see that each section has, it is organized in such a way. It is organized according to your body system. Okay. Here, if you are using any kind of biopsies, you're taking out a piece of material from the body for analyzing. It is called as biopsy. So that also is given here. And you can have surgeries done on many different organs or organ systems in your body. So if you look at this, this is again it is a surgery on your spinal column. And so this is about your procedures, and I also showed you about your um, ICD-10 codes. Now let us see about how to code for equipment that is given in the process of treatment. So if you look at some of the equipment that is given, I'll just show you the index of this book, where you can see the different equipment that is given to the patient. Here, there even some of the drugs or medications that are given can be coded. For example, if I say wheelchair, for example, a patient might get a wheelchair when he is having uh, fracture, or when he is unable to walk. You will have wheelchairs given, and so you can just look at how that is given. Here, you have wheelchairs which are coded with alphanumeric code. So all these things are coded using this HCPCS, which stands for Healthcare Common Procedural Coding System. So you have ICD-10 CM, and you have your CPT and ICD-10 CM. Okay. Okay. So this is about the material that you have to learn. So I think I have covered everything that goes into your syllabus. Now I want to hear your doubts, any queries that you have for me, so that once they are clear, I'm sure you will be ready to join our academy in medical coding training.